Hi, Professor. This is Sora Lopez again. I'm here to record my critique of the client practitioner role play session. So first and foremost, when I was reviewing the session, I noticed a lot of things. I noticed a lot of strengths, but I also noticed a lot of things that I'd like to work on. The first one is my introduction pitch. So I love introductions. I feel like when I go into a therapy session, I kind of want to, know what to expect. That's me personally. So my style, I'd hope, is kind of working on an introduction so that the clients are aware of what we're going to be discussing and they kind of have more of a heads up of what that looks like and things that they can expect within our time during that session. But as I was reviewing my um my whole role play, I noticed that I was kind of all over the place. So I would definitely like to have like a strategic way to work through that, to introduce it so that clients have a better understanding of what to expect when they work with me. One thing I noticed, and this is maybe just because I did it with my younger sister, but one thing that I noticed is I assumed that she would see me as nosy. And as I'm watching this, I'm like, I don't know how a client would feel about that. I know she wouldn't take it personal, but when I think back to, the assumptions, the different belief systems, value systems and things like that, I could potentially be offending somebody. So I think I would stay away from trying to impose those kind of um, terms in our session. I would just, make sure that they try to reassure them that I'm not trying to, you know, just bombard them with all these questions. I really do have a reason behind the questions that I do ask them, and I just want to reassure them that that's the case. I also noticed that throughout the session, throughout even the introduction, I did emphasize the closing case too much. And I think that happened because I want to be very transparent. But as I was, asking for feedback from my sister, she did mention that that was something that was kind of like a little weird. She's like, well, this is our first session. How are you already talking about, closing? And I totally understand that. It's probably not the most appropriate time, maybe just mentioning it. But just kind of working on how to share it, but maybe not emphasize it as much, or even the explaining process. I don't think I explained it properly towards the end of the session. I was kind of rambling a little bit of what that looks like. I even said something about the insurance that kind of came out of nowhere. I think because, like I said, this week's reading and mentioned something about that. So I'm kind of trying to be mindful. If I have 15 sessions with the client, I want to be very transparent and let them know we have 15 sessions together because of your, your Medi-Cal benefits or your insurance benefits, things like that. I want to be transparent, but I think I need to find a better way to do that without trying to without making a client feel a certain type of way. I don't want them to see like, you're on a ticking time bomb, like I'm counting your time and stuff like that. I don't want that to be perceived. So I think I need to work on kind of that piece. Um, what else? I did try to maintain eye contact. So I think that was something that I really tried to do. I know she wasn't really looking at me, but I tried to make sure that I was looking at her so that my body language was stating that I am actively listening to what you're trying to say, and I am actively trying to understand what you are, what your challenges are and what are the areas that you want to work on. I did try to show empathy and patience. So I did, try to reassure them that this is tough. This is challenging. These situations are not easy to kind of work through. But I also patience, right? Like this isn't going to be something that's going to be done overnight. And I think that's something that can benefit a client is just that reassurance. Some people come in thinking that therapy is going to be this magical wand and everything's going to be better, and they get upset when they're 3 months in and they see little to no progress. And sometimes it takes a minute, it takes a while to really identify all of these barriers. So I just kind of want to make sure to reassure the client that I'm patient and I'm going to be patient with them while I'm working with them. um I think another thing I would like to work on is the responses after a client shares challenges. So that's something that I noticed I was kind of lacking on. Is I'm like, oh, I get stuck in my head and I'm like, what do you say? Like, how do you respond to that in a way where it's appropriate in that time where you show empathy, you show the patient's consideration, all that, but you also don't say the wrong thing. So I think for me, it's working a lot on the responses that I saw. I did really try to use my active listening skills. So I really did try to repeat everything that a client was saying. So when they stated, that they go to the gym, I wanted to make sure that they knew that I heard them. You go to the gym. That's a big piece of your routine. That's a big piece of your outlet. That's what makes you feel good, is going to the gym. So I did try to make sure that I was repeating as much as I could without like bombarding them with what they're saying. I was trying to be, I know there was a part where I did mention past experiences. And I think something that I've learned, just being in the field myself, is to be very, very cautious with that. I could have triggered somebody in that. And I think I didn't think about it until I saw it again. But I think I have to be very careful with that. I'm asking a client to talk about a past experience that could be years ago, and it can bring up different emotions. It can bring up different feelings. It can bring up different events. And that's something that I may not be prepared for first session. So I think just kind of noticing that I want to stay away from bringing up some past experiences, at least more than like, I mean, they're talking about childhood, right? So that's a couple years down. So just being more mindful on that. I do feel like I did scramble through a lot of my words. I had so much going on in my head, and but I was really trying to be present. I think trying to find the balance of like being present and then trying to find a balance of like, what do you say next? It really made me feel like there were so many things in my head and it just kind of scrambling. So I think that's something that I would like to work on, is just kind of finding that natural response with the natural words coming out, and just trying to be as genuine and natural as possible. I think one thing that I really worked on and I really wanted to state is the overwhelming. So clients coming to you, they're already feeling overwhelmed, they're already feeling lack of motivation. So one thing I wanted to make sure was this client did not continue to feel like therapy was going to be that for them. So I broke it down into, we're going to work on one goal. I know I mentioned two, but we're going to work on one goal because clearly this is an area where you are struggling in. You find it affecting your day-to-day life, and we're going to work on just one goal at a time. I kind of talked about a little bit of the ways we would measure it. So I think just kind of be mindful of that. I did provide a solution. But I tried my best not to press that too much. I said, hey, this is something that, what do you think? How do you feel? And I think that was good. But I want to be mindful with that too, because I never want a client to feel that I am telling them what to do. This is their experience. And I just want to make sure that whatever goals I give them, it's attainable for them, in their unique situation. So luckily the client was open to it, and I was able to kind of um, talk to them a little bit about that and how that measuring is going to look like. Another thing that I like is reassuring the client that this is their session. I think that is something that I find just tremendously helpful for me when I'm in the therapy session. In my work, I see it where clients feel more autonomy when they feel like they're the captain of the boat, and you're just kind of there to be co-captain and help them when they need the help. So for me, that was something that I wanted to make sure the client understood, and I did make sure that I reassured them on that. And then just the reassurance of grace for themselves and patience. Like I mentioned earlier, sometimes, some people expect to see overnight results, and it's not the case. And sometimes it can be discouraging. If you find yourself trying to build consistency like this client was, and you don't see it within 1 to 2 days, consistency takes time. It's a consistent pattern, and that takes a lot of time and dedication and self-reflection and different things. So I just wanted to make sure that the client understood that this could potentially be a long process. I wasn't assuming, but trying to just help them understand that, there will be some things that come up. And when they do, I want to make sure that I did make a welcoming, safe space for them to come in. So hopefully I was able to provide that. There were, like I said, a lot of things that I saw that I could work on. And then there were some things that I was like, okay, I like that. I like that. That would make me feel good. But I also have to be mindful of that because I'm not going to be working with me all the time. So I think just overall, just kind of going through that process, I did enjoy this very much. I think it really helped kind of align everything that we learned in the last 7 weeks. I did kind of have these different things in my head that I wanted to remember from the things that I've read, some of the assignments that I've done. So I hope that I did well. And even if I didn't, it was awesome. It was a learning experience for me. And yeah, so I appreciate all your help, and I hope you have a wonderful rest of your day. Thank you. Bye-bye.